The gentleman from Michigan reserves the balance of his time. The gentleman from Georgia, Mr. Gingrey, is recognized.
Mr. Speaker, I rise today in support of H-Con Res. 323, expressing congressional support for the goals and the ideals of National Healthcare Decision Day. National Healthcare Decisions Day was recognized by hundreds of organizations across the United States last Wednesday, April the 16th, and it's appropriate for this body to stand with those organizations in recognition of this important day. Mr. Speaker, first of all, though, I want to thank the distinguished chairman of the Energy and Commerce Committee, Mr. Dingell, and his staff for their cooperation in helping us get this to the floor. I want to thank the ranking member, Mr. Barton, and the minority staff, and the 100 members, many of them members of this committee, who are co-sponsors of this resolution. Mr. Speaker, the goals of the resolution are twofold. First, it aims to raise awareness of the importance for everyone at all stages of life to take the time to discuss important end-of-life medical decisions with their loved ones. Second, this resolution recognizes the efforts of over 450 organizations spanning all 50 states that worked together on April the 16th to educate Americans about their options in preparing advanced medical directives and appointing medical powers of attorney. Of these groups, 75 are national organizations, including AARP, the American Bar Association, the American Medical Association, National Right to Life, and an additional 370 state and community organizations participated in the National Healthcare Decisions Day effort. Mr. Speaker, as a result of National Healthcare Decisions Day, thousands of people across the country have received information on advanced directives through newspaper articles, television and radio broadcasts, all released last week on April 16th. I want to thank and congratulate all those involved for their hard work on this important cause. I'm also proud of the broad bipartisan support this resolution has garnered. Companion legislation sponsored by Senator Wyden and Enzi has already passed the Senate, and now over 100, as I mentioned earlier, of my fellow House members from both sides of the aisle have signed on to this resolution. Mr. Speaker, I want to urge the American people to invest time and effort into seeking out information on advanced directives. Advanced directives allow individuals to maintain control over their health care decisions even at the end of their lives, regardless of the circumstances they may face at that time. And I also encourage Americans to educate themselves on the options and details of the various types of advanced directives so that their wishes may be correctly documented and carried out. Let me be very clear. This bill does not express what an individual's end-of-life decision should be. Those are decisions that should be left to the individual undertaking this difficult but important step. This resolution merely seeks to raise awareness about advanced directives themselves, and that's why this resolution is being supported by such a diverse range of organizations. Educating individuals and making them aware of their choices is a key to respecting and preserving life. Mr. Speaker, as a physician, I cannot stress enough that these decisions should be made with the input of medical professionals and should be accessible to the patient's doctor in the time of greatest medical need. Too many times, families are left to guess what medical decisions their family member would have wanted. Think about the Terri Schiavo case a couple of years ago. But physicians are sometimes left to guess as well. A recent study by the U.S. Agency for Healthcare Research and Quality found that 75% of physicians whose patients had an advanced directive were not even aware that those directives existed. This is a problem, Mr. Speaker, and I hope that as we get electronic medical records and HIT, health information technology, becomes more sophisticated and interoperable, these advanced directives can be stored electronically and be made accessible to the medical staff in an instant, really, in a timely manner. So in conclusion, Mr. Speaker, I want to encourage all Americans, set aside time to have what may very well be one of the most vital conversations that any family can have. And I urge my fellow members to vote in support of this resolution and to recognize the critical role of education in allowing Americans to effectively express their end-of-life wishes. And with that, Mr. Speaker, I reserve the balance of my time.
The gentleman from Georgia.